Good morning. Welcome back to 1160 AM KBDT News Talk Sports. We are JP, Kathy, and the crew. We come to you live Monday through Friday from 7 a.m. to 9 a.m. And today is Tuesday, where we bring you the mental health moment. We have moved this back a segment. Very, very excited to have Dr. Lynn Jonen on the line with us. She is the Director of Psychology and Clinical Services out at Sierra Tucson in Tucson. And I can tell you had a wonderful conversation with her, myself, Steve Dunn, and Patty Giolet, and I mean, are really, really excited about today. We are joined with the Morgan Foundation with Steve Dunn and with Patty Giolet from Something for Kelly Foundation. Good morning, everybody.
Morning, John.
Good morning.
Good morning.
Good morning, Patty.
Dr. Jonen, good morning. Patty, good morning.
Good morning. Thanks for having me.
Well, Dr.
Hi.
Jonen, thank you, first of all, so much for getting up so early in the morning.
It's anything for mental health. It's my pleasure.
Oh, that's great.
Fantastic. Dr. Jonen, tell us a little bit about yourself and including some of the other programs that you may be leading, and let us know what it is you're doing in some of these fields.
Sure. I am a clinical psychologist, and right now I am the Director of Psychology and Clinical Services at Sierra Tucson, which is a residential treatment center in Tucson, Arizona. I'm also an academic advisor for the National Institute of Whole Health, and this is a program that started in 1977, and we train credentialed health professionals how to address the whole person through education whenever they have an encounter with a person, physicians, nurses, other health professionals.
You know, today we are going to tip the scales, and really to me, and I know this is going to sound terrible, but this just sounds so innovative. What is a mental health checkup?
Well, a mental health checkup is just like any other checkup. Just like we take our cars in for a checkup or an oil change, or we visit a dentist regularly for a checkup. A mental health checkup is seeing a professional or possibly doing it at home where you're looking at your mental health. And it's an opportunity maybe to talk. Go ahead.
Is it scary? Is it something we should be afraid of? Are insurance companies going to use it against us? Is it something that is public? I mean, tell us, you know, is it a good thing, a bad thing?
Well, I think it's always a good thing. And I think the shift is happening. We're focusing more on wellness, and shows like yours are helping change the conversation about mental health. And really, you're just checking in with a professional to identify any potential problems.
You know, and that's the key, right? The key is this is part of the, and I loved when you said wellness. So a mental health checkup is more like part of your wellness time when you go in and see your doctor, right?
Exactly. We're all dealing with stress every day. Go ahead.
No, go ahead, Dr. Jonen. You go right ahead.
So we have stress in our lives. We have financial stresses and relationship stresses, and I think it's nice to touch base with somebody who can help you put it in perspective and say, you know, okay, this kind of stress, it's okay. It's making you work a little harder. This kind of stress, it's actually causing you some problems that we might need to address before they become big problems.
How common is it? How often do we see people going in for mental health checks? And then how do we get people to start doing an annual mental health check?
Unfortunately, I don't think they're as common as they should be. People usually, when they have the first signs of difficulties, they usually try to push through and maybe not have time for a mental health checkup, maybe don't think it's important. I'm well enough, I don't need to talk to anyone. And I think, you know, normalizing the experience of stress and normalizing the experience of emotional problems and mental health difficulties can go a long way toward making it more acceptable, more normal to see a mental health professional and have a mental health checkup.
Doctor, this is Patty. When somebody's doing something at home before they do go to their physician or clinician or whomever, give us some tips as to when it would be a good sign or a trigger that they may need to seek professional help. When does my stress get to a point that I should try not to manage it myself anymore?
Great question. When you're at home and you're thinking about things, you want to look at how manageable is your stress. You want to look at your lifestyle habits. Are you doing the things that you know are healthy? You want to look at your diet. You want to look at your work habits, your sleep habits. You want to look at your ability to fulfill your life obligations. Are you having to miss work because you're stressed or having concerns? Are you satisfied with your overall functioning? How are your relationships going? And then any other feelings or behaviors that are causing you concern or family members say that they're causing them concern.
All right, stay with us. We've got Dr. Jonen on the line. We will continue the conversation through the break. You can catch that at JP, Kathy, and the Crew on our social media page on Facebook as we will continue to talk about this and lead right in to the next segment. We'll be right back after these messages. Continue the conversation. Do you have more for that answer?
Well, you want to look at your life.
Excuse me just a second. Excuse me a quick second. John, could you sneak your level up just a touch?
Yes.
Thank you.
And,
Go ahead,
and John
John.
David Wells, is he on mic 2 or 3?
There we go.
Mike too.
There we go. Okay. I didn't want to have them both live, so excellent.
Okay, back on.
to the conversation.
Sure.
Doctor, how when we talk about mental health checkup, can you talk a little bit about what exactly is that? We've talked about it, but we haven't really defined. What is a mental health checkup?
So a checkup is getting resources, talking with a professional to find out how you're doing. How where are you on the continuum from wellness to illness? You want to look at, is your life manageable without too much additional stress? You'll be asked about lifestyle habits. How's your sleep? How's your nutrition? You'll talk about, how is your gut health? How is your spiritual life? How are all of your relationships? Do you have any concerns about any of your feelings or behaviors that you'd like to talk to somebody about?
So, there are just so many types of mental health issues out there, from stress to depression to anxiety. The list goes on and on and on.
Yeah.
You would think you would have to find a mental health provider who also has a medical background and the expertise to be able to take your information and give you an accurate prognosis and directions how to go, though. How do you find someone like that?
Great question. So the easiest answer is a psychiatrist. A psychiatrist is a medical doctor who specializes in mental health. So they can look at blood work and consider medications and physiology, in addition to looking at mental and behavioral health concerns. Another way to go, if you're having a mental health checkup, is someone who focuses on education. So we have all kinds of counselors, social workers, psychologists, naturopathic physicians who look at the whole person and are educators. Somebody who's engaged in looking at the whole person and is an educator is a great person to have a mental health checkup with.
So let's say you might want to look for someone at UT Southwestern here in town. Let's say, would you recommend more a university-based professor or doctor for something like that, who not only has a clinical practice, but also has the educational substance there as well?
Right. Well, that would be a great idea. The education also comes through in clinical work. So we have a lot of specialists who go to school and might be involved in academia,
1 minute.
but all of that schooling, all of that education actually comes through in their clinical work. So you want to find a clinician who is credentialed, who's licensed in their field, and you want to talk to that person first and make sure that they're going to be able to provide mental health checkup services you're looking for.
Very good.
And then we've got about 30 seconds, doctor, until we go back on. You're doing a great job. Your voice sounds great. Thank you so much for talking about such an important topic. And Patty, we miss you.
Wish I were there. You guys sound great.
Yeah, we wish you were here instead of Chet. Oh, sorry.
Dr. Jonen.
Oh, I'm sorry. Whatever his name is. I'm concussed.
Dr. Jonen, I found the Arizona Revised State Statutes, by the way,
10 seconds.
on bullying. Good morning. Welcome back to 1160 AM KBDT News Talk Sports. We are JP, Kathy, and the crew. You want to stay tuned, that's for sure, right after us and all throughout the day. You do not want to miss what we have late this afternoon after the Wells Report. We have Wayne Allen Root, raw and unfiltered, this afternoon from 5 until 8 p.m. only on 1160 AM KBDT News Talk Sports. I want to thank the Morgan Foundation and Something for Kelly Foundation and Acadia Healthcare for providing the mental health moment this morning, and Dr. Lynn Jonen from Sierra Tucson in Tucson, Arizona. Dr. Jonen, again, thank you for joining us so early this morning.
Yes, thank you for having me.
Now, you're not going to need a mental health checkup after getting up so early, are you?
I just might. And there's nothing wrong with that.
There is absolutely nothing wrong with that. You know, staying along the lines that we have been talking about, and people have a tendency to not want to go to the doctor or go to the dentist. They'll let things carry on too late. And so that's why I think that it's great to have an annual mental health checkup as a wellness, part of your wellness visit. Can your family practitioner do that for you?
Most family practitioners either address mental health or they have someone in their network that they can refer you to speak more in depth about mental health. So most primary care providers can do a mental health checkup.
So when you're sitting in the office with your doctor, what are some of the things the doctor should be looking for when they're talking to you about your mental health checkup?
They're going to look at your whole lifestyle and your whole health. So they'll look at how are you functioning on a day-to-day level? Are you able to meet your daily obligations without too much stress? Do you have work stress? Do you have relationship stress? Are you moving your body? Do you have healthy lifestyle habits? Do you have any of the lifestyle habits that we know lead to chronic illness, like smoking or overuse of alcohol or sedentary lifestyle, things like that? They'll ask you how your relationships are going. They'll ask you if you have any concerns about any of your feelings or behaviors, or if any of your family members or friends have commented that, hey, you know, I've noticed this is concerning to me.
Well, and doctor, if I may real quick, something that's now part of, and I don't know if this is all pediatricians, but I know the pediatrician that both of my kids have gone to, they do a thing where they've got like an iPad device of sorts, and without the parent does one while the kid's doing one, and these are strictly questions to see if your child is depressed. And I think it's a great practice because you can be alerted to something. I don't know if that's just Dr. Carolyn Evans at North Dallas Pediatrics, who we've gone to since my daughter was born 20 years ago. But I know that's something that when they introduced that into their annual wellness visit, I was thrilled.
Oh, that's great. My kids are a little older. We didn't have iPads when they were seeing the pediatrician, but that is wonderful to hear.
So if they do that, then when I go into my OBGYN or when I go in to see my blood pressure doctor, which I see those doctors a little bit more often than for a wellness check. But I mean, is that something that maybe can be legislated, that doctors do even 10 questions can tell you something?
Right. And I think that when we go in for medical appointments, we're most often screened for mental health, and we have the opportunity to have maybe a mini check-in at that point.
Yep.
You know, and that brings up a good point, Kathy, and I'm going to ask you, Dr. Jonen, from a clinical perspective, I mean, should we be legislating some kind of mental health, if nothing else, basic assessment with our family practitioner when we go in and see our doctors?
Well, I think that we have legislated reimbursed preventative care services, right? So we're kind of shifting the reimbursement structure so that physicians and other medical care providers do get reimbursed for preventative services. And so that's a big deal, because that means that you don't have to have a problem to go in, and you actually are more likely to get more preventative education and lifestyle education when you go to see a medical care provider.
Doctor, in fact, on that point, we know a number of years ago in Australia, Deloitte and the Butterfly Foundation funded a study on eating disorders that showed if you spent $1 on preventive care at the start, it resulted in a savings of $4 in treatment at the end. Do you know if there have been any domestic studies on mental health along those lines?
Yes. So there are small studies, and we see a savings in treatments based on preventative care when we look at very specific populations. So this question is actually pretty complicated. It depends a lot on the specific preventative intervention and the population it targets. So for example, when we target the entire population over 50 with the recommendation of annual colonoscopies, or we target the all women, target's not the greatest word, but when we encourage all women to have mammograms every 1 or 2 years, we're actually not going to see the savings, because the upfront cost is targeting the entire population, and it's harder to see savings because the upfront costs are so expensive. Now, the place that we see savings, we all know intuitively that prevention keeps disease at bay and increases lifespan and helps us have higher quality of life. The way that it does this is through those preventable causes of death, like tobacco smoking, poor diet, physical inactivity, misuse of alcohol. Those factors have been estimated to be responsible for 900,000 deaths annually, nearly 40% total yearly mortality in the United States. So this is where we want to target our education and our preventative efforts. So instead of blanket recommendations for medical procedures, so I'm just thinking about dollars here, blanket recommendations for medical procedures, that gets pretty expensive. Education targeted at smokers to stop smoking, we're going to see a lot more dollar savings in the long term when we address these lifestyle factors and we target the specific populations that need them.
So, doctor, is there anything online that a person can go to and kind of perform their own mental health checkup? Are there any mental health checkup websites out there?
I'm not sure there are mental health checkup websites per se. There are lots of surveys you can take. The biggest warning is you never want to get onto a site that asks you for any personal information or charges you money to take a survey. I really like the National Institute of Mental Health's website. The National Institute of Mental Health is a branch of the National Institute of Health, and they have it's at www.nimh.nih.gov. It's our biggest government research institution, and they have a wonderful place on their website called Health Topics. And this section has information on all of the psychological concerns, signs and symptoms. It encourages you when you need to see a provider. It has tips for finding a provider. And they have links to other websites that can offer more information.
Very good. Doctor, as the scientific research becomes more sophisticated, we're beginning to find out that mental illnesses, as they've been defined, have biological roots. For example, I think just this past week, addiction was reclassified as a brain disorder, and it's going to start to be treated along those lines. As we learn more about mental health, the biological aspects of it, how does that impact a mental health checkup, or what doctors need to know or ask?
Great question. So I think it's wonderful that we have more and more scientific information that helps us understand the biological and genetic basis for mental health problems or mental illness. The important thing to know is that no mental illness is 100% biologically or genetically determined. So we might have a predisposition, and a physician might ask you about your family history. Who in your family has struggled with this? And that's how we see genes and biology passed on most strongly. Now, there's always going to be things we can do about that. So nothing is 100% genetically determined or biologically determined. The sciences of brain plasticity and epigenetics confirm that we can change our brains and impact gene expression through lifestyle changes. So you might have the gene, but there are things that you can do to turn on or turn off the expression of those genes. And I think another thing that, understanding better the biological basis of mental illness does is normalizes it more. It makes it more akin to a medical problem, and it's just something that you need to have addressed. You need a treatment for.
So as that is done, does that also increase the likelihood of additional federal funding and grants to study a certain type of mental health issue? Because now you might have a genetic cause, you might have some genetic markers or a biological aspect that here to now has remained completely unknown.
Yes, it will. And one of the biggest reasons it will is because when we understand that things have a more biological or genetic basis, that opens up a whole new world of treatment. So we're going to look at medications and gene therapies and biological and genetic treatments in addition to the behavioral mental health treatments that we engage.
Dr. Jonen, let me go ahead and shift us just a tad. When working with kids, and family members, of course, should have the best beat on what their child and how their child is feeling, acting, and what they're doing. What does a parent look for in a child to be able to help their kiddo and maybe do a little survey with their kid to make sure they're okay mentally and mentally healthy?
Well, they want to have good communication with their child. Children and adolescents often have more difficulty talking to their parents than they might, say, a school professional or a counselor or a mental health professional or their peers. And so you can ask the kids how they're doing, you can look for certain behaviors, and you can make it normal to have them go in and see a counselor or a medical provider for a mental health checkup.
So what are some of the things a parent should look for? What are some of the signs without even having to talk to their child?
If you see a big change in functioning, a big change in school functioning, a drop in grades, if they need to spend a lot of time alone, if they're having difficulty expressing emotions, if you see increased anger or acting out, or all of a sudden they stop talking to their friends, if they are having difficulty eating, or if you see any behavior that's out of the ordinary.
So how can parents go about finding and obtaining information on doctors, clinicians, treatment centers, if they find that their child is meeting some of the criteria that you just mentioned?
Great question. So when they're looking for a provider, I think it's best to contact the providers directly and ask specific questions about the services they provide. What's their style? What's their history working with concerns like the ones you have? How do they address that type of concern? You want to ask them about their scope of practice. You want to ask them how much do they focus on education versus maybe prescription or medical care? How much do they focus on the mental health checkup? How important do they think that is? And how what's the level of engagement with their patients? How often do they see them? How do they follow up? Things like that.
Where's the best place to get started asking for referrals for these types of physicians and practitioners? Where would a parent go to find these folks in the first place?
So if they have an established primary care provider, that would be the best place to start. They could also look on professional association websites for referrals. They could, if they have insurance, talk to their insurance providers and find out who's in network. And of course, they can talk to friends and community members and find out, who's been having good experiences.
Now, are the high schools, middle schools, are those good places to go back to as well as a point of origin?
Absolutely, because the kids spend most of their time in school, and the mental health concerns don't go away when they move from home to school. In fact, sometimes they might get worse in school.
All right, very good. Stay with us, Dr. John, and don't leave. Again, as we go to the break, we'll continue the conversation. I want to again thank Morgan Foundation, Something for Kelly Foundation, and Acadia Healthcare for bringing us amazing experts week after week to help you with your mental health questions and potential mental illnesses that you may have to face day in and day out and sometimes don't even know it. Again, thank you to Acadia Healthcare. Stay tuned. We'll be right back after these messages. During the break, or
Excellent.
Kathy?
We can still talk. Hello.
Okay.
Dr. Yes, how often do you recommend that family-based therapy be included as well? Not just the person who is suffering, but you bring in the entire family and educate them and talk to them as a group.
Every single time it's possible. I think that a mental health checkup for a family system is a great idea. We all need to look at our family communication patterns, any roles that we're playing. Sometimes we get into certain helper roles or a fixer role, or and we need to have the whole family aware of the dynamics that are going on there.
You mentioned the fixer role. Are there some very unique challenges that are faced when you get men and you get dads and we're trained that we fix things.
Oh, moms too.
And if we dads have mental health issues, for the most part, it's been, just rub some dirt on the thing and you'll be fine. Are there some unique instances or the things you have to look at when men are directly involved?
Well, again, we have to normalize all kinds of behaviors. We have to understand that men can be nurturing too. We have to give men a break. We have to give women a break. That's the whole problem with these roles, is we get kind of stuck in them, and when we leave the role, we don't get good feedback from people. Yet we're all multifaceted, and it's very difficult for anyone who gets stuck in a particular role. It doesn't feel good, and it's hard to get out of it.
I agree. And I think it's one of those things that then when you start trying to get out of it, the person who has the mental illness or mental illnesses can demonize you. And then you feel worse. And so then you're like, oh, okay, I've got to go back to what I was doing. But maybe that role wasn't working and never worked, even as hard as you tried.
That's exactly right. So anytime a family member in a family system that's humming along and developed the way it developed to get the job done of being a family, anytime someone changes their role, it can be anyone, the other members of the system are going to be confused, and it's going to be uncomfortable, and they won't like it. And either directly or indirectly and subtly, they will let you know that that's not okay. To be in this group, to be in this system, we need you to be a certain way. And so every member of the family system has the potential to feel kind of stuck that way.
Yeah. And then you go back and it's just kind of a vicious cycle. It's tough. I mean, I think it's just as hard on the person who's trying to take care of or love the family member with a mental illness. It wreaks just as much havoc on both. I mean, it really does.
It stresses the whole system, which is why, you know, a family system mental health checkup is a fantastic idea.
And then, of course,
Yeah, it is.
what do you do when the family itself is part of the issue, that there's a toxic environment at home? How difficult is it to recognize something like that? I know we're about to go to the 10-second mark, so you might want to respond to that after we come back.
Steve, you want to go ahead and
Okay.
re-ask that when we come
Yeah.
back?
Absolutely.
For people who are listening.
Okay.
Or John,
10 seconds.
unless you'd like to run with that, John.
Good morning. Welcome back to 1160 AM KBDT News Talk Sports. We're JP, Kathy, and the crew. We come to you live Monday through Friday from 7 a.m. to 9 a.m. And today is Tuesday, is the Mental Health Moment provided to you by the Morgan Foundation and Something for Kelly Foundation with Steve Dunn and Patty Gillette and Acadia. We want to thank Acadia for all they do to help bring mental health to the surface and allow us to address it in a healthy way, giving you the opportunity to take advantage of all of the options available to you in the comfort of your home, in your car, or as you watch JP, Kathy, and the crew right here on social media. We've got Dr. Jonen joining us from Sierra Tucson in Tucson, Arizona. Steve, you had a great question during the break. If you will go ahead and repose that question and let Dr. Jonen answer that question.
Absolutely. During the break, we talked about the importance of having the family involved in the treatment process and counseling process. But what do we do when the family itself may be part of the issue, and there's a toxic environment that may be in the home?
It's a great question. And so when the system itself has mental illness, it's very important that we step it up. So a family system checkup might not be sufficient. That's when we need to engage the family actually in treatment, like we would think, you know, the person who's expressing the problems goes to treatment. And one of the most important parts of treatment at Sierra Tucson is our Family Week, where family members and loved ones come and they go through a week of education and supportive therapy to look at the family system, to help the family members and loved ones understand what the person with identified mental illness is going through, and also to look at the whole system and look at those communication patterns, look at the relationship patterns, the roles, and address the mental illness of the system.
Doctor, what can you say to people about chronic, lifelong mental health issues? Can you give some hope as to the ability for a patient to overcome some of the mental health issues they might be struggling with?
Sure. So people who've been struggling for a long time can often feel less hopeful about resolution of those problems. We have to go back to all the research on whole person functioning and the brain and epigenetics and our ever-evolving understanding that we have the power to address mental and physical health issues with lifestyle change, with interventions all the way from, you know, medical care, physical therapy, changing your diet, looking at your sleep patterns, looking at your gut health, looking at your lifestyle habits. And there are always opportunities to improve health no matter where you're starting or how long you've been dealing with those difficulties.
And of course, we know that there is hope there. At the end of September, President Trump signed a $1.85 billion bill reaffirming the funding for autism research and studies. So we know that the government will get involved if compelling facts and circumstances are presented, then they will step to the plate. For the other types of mental health, how important is that, and what can people do to try to make that happen?
Well, yes, legislation is a very important part of what we need to do to make mental health checkups more pervasive and to normalize mental health treatment, to get it into the schools. You know, the Mental Health in Schools Act in 2015 kind of brought mental health counseling, trauma-informed behavioral care, violence prevention, school-based behavioral health providers, and then hooked schools into communities so that we're all able to address the mental health of our young people in schools. National associations like the National Alliance on Mental Illness and the National Institute of Mental Health are very involved in research and policy change through legislation.
Excellent.
Dr. Jonen, thank you
stuff.
so very much
Great
for joining us
stuff.
this morning. Again, know it was super early out there in Tucson, so I cannot thank you enough for joining us.
It's been my pleasure. Thank you very much.
Thank you.
All right. We
Thank
also
you
want
for
to
your
thank
time.
Acadia Healthcare for doing what they do by getting us on the air and getting the mental health moment out there to you. So that way you have an opportunity to have an intelligent, advised way to make decisions towards mental health and maybe to address it before it gets too bad and becomes a mental illness. All right, we want to thank the Morgan
Share
Foundation
our
and Something for
Facebook
Kelly Foundation
page.
as well.
Share.
Steve Dunn, thank you. Patty Gillette, thank you so very much.
Have a
All right,
blessed day.
everybody have a blessed day out there. We'll see you tomorrow.
We've got a
Okie dokie smoky.
So please, those of you who were on today, go out there and share this. Tell people to tune in at 8:24. Well, heck, tell them to watch Van Taylor's interview and then tune in at 8:24. This is really important stuff. And if you've got a doctor who's not asking questions and you feel like you're in trouble, ask them please refer me to somebody who you trust, who's in network, whatever the case may be. Just so these questions can be asked. I think that's so important, and we don't ask it. We get to the doctor's office and what does everybody do? Even though they've got 10 things on their mind that they think's wrong with them. Oh, I'm fine. Yeah, I'm good. How are you?
Oh, absolutely.
Because we're so polite. It's like we're afraid to go, you know what, things aren't going well. Just not doing well at all. Your doctor's who you can trust to say that to, because that's going to be as private of a conversation as you can have.
And then next week, we have a very unique guest on the show. Her name is Bianca Jackson, and she is with the organization called New Friends, New Life. They are a local organization that helps try to erase human trafficking. They provide counseling, employment opportunities, education opportunities. They work with the police and DA's office. They do some incredibly important work, and just the mental trauma that these young people, kids, go through is just unbelievable. So we'll address that. I'll leave you with one statistic.
Yeah.
On any given night, there are 400 people on average who are victims of human trafficking. Now, that's not in the United States. That's not in the state of Texas. That's in the city of Dallas.
That's what's so scary. I don't think people realize this is in our own backyard.
Absolutely, it is.
I mean, it is what it is. It's right here. It's right here.
Let's put it this way. The city of Dallas itself is about 350 square miles. That means there's one person in every square mile in our town,
right,
who are a victim of this. So we are excited to have her on next week and just expand things to a different topic a little bit.
But something very relevant.
Yes.
Something very relevant. So, well, thank y'all. Please, like I said, share the post if you know of anybody. I mean, even if you share it through Messenger to maybe a friend of yours who they've got mental health issues in their family, or something like that. I know we had a member of the crew who had shared the post, one of our posts, on his page publicly, but then also he shared by accident. He shared a post to a friend who he meant to send something else to in Messenger. Turned out her son was in crisis and needed help that day. And because of the speaker that we had in here, the guest that we had, they were able to get this young man help. So just you never know. You never know whose life it is you're going to save, who you're going to make feel better because we're talking about it. So anyways, well, you guys have a blessed day. JP will be in studio tomorrow. Like I said, I've got a funeral, so I will see y'all on Thursday. And thank you guys for coming in.
Always fun.
All right.
Thanks, Kathy.
Y'all have a blessed day. Love y'all.